things we'll be talking about and rotating our times. My section today is on ADHD in adults with the title of Identity, Life Course, and Spiritual Impact. The other two doctors did the heavy lifting of information, and I'm very thankful. They're younger and they're energetic and they have all the data and the current information, and so you have a couple PowerPoints with a lot of great information sets there, and I wanted to have them provide that for you. Mine is a little more philosophical, a little more spiritual. There's not as much out there on adult ADHD because it's a relatively new focus for research on ADHD, but it turns out that it's a lot more socially out there now, so people will talk about their mental illness as ADHD, and it will be an acceptable, kind of a humorous punchline in some ways. It's because, you know, my husband has ADHD, and that's why such and such, and everybody laughs at parties. Or some of the entertainment industry people will talk about ADHD in a humorous sort of way. And so it's become a lot more part of the cultural, societal awareness, and not scary, and kind of benign and endearing almost. I think decades ago we used to talk about the different stereotypes, and one of them is kind of the ditzy blonde girl who was kind of spacey but very cute, and that's another picture of an ADHD kind of humorous but caricature of what we had a long time ago. And so ADHD in adults and kids, that's been around for a long time. We just now are getting a lot more specific and a lot more information based of what it is, and that it's not really that benign. It's not that light of a disorder, and it has a lot of effects. And I liked Dr. Berg Martinez's talk about not blaming and being shamed by this, and that's a really big part of all the things that we're doing here with these workshops, trying to combat stigma. But with ADHD, it's kind of something that in society we play with a little bit. And, with all the information that you had earlier, we know that there's a lot to it, and there's a lot of medical information, a lot of research information, and it can be really a major developmental problem that lasts throughout a lifespan. So when I get adults in my practice talking about their kids with ADHD, or they were diagnosed when they were kids, but they never got on medicines, and they never were treated, but they're okay and they don't want to be considered for treatment. After you see this over and over again, and let's say if they have a depression or anxiety problem that they're coming for treatment initially, and they say, oh, by the way, I have this ADD problem, I can't concentrate, and I have trouble with organizing and so forth. A lot of people will still feel very kind of burdened by the idea that they have this diagnosis, or there's a problem with their attention span, but they'd rather not deal with it. They'd rather be okay. And so the first part of the first slide that I have is kind of a list of different rationalisms or rationales for the reason why as an adult I sort of don't want to deal with it. I don't want to think about it. I don't really have a problem with it. It's fine. So I am fine. I've made it this far, and I'm okay. I have problems, but who doesn't? I don't want to see a doctor or counselor for ADHD. I don't want to take pills. God made me this way. And medicines are kind of unnatural for my body, so I want to use the least amount as I can. I want to stay as natural as I can, and I'm afraid it will change who I am. So all of these statements are different ways that, you know, they're ways of thinking, but they're all also ways that we kind of rationalize ourselves for a lot of things. I don't want to change who I am. I'm okay, it's not so bad, and I feel fine. So we'll go through a little bit about some of the issues in adults that I come across, very similar to what kids and teens go through, but as adults you've gone through a history of life and relationships, and you've gone through different career issues, gone through different life experiences, you've gone through maybe college, maybe trade school, maybe careers, maybe different marriages, and you know, you look at the whole big picture and you think, well, how much of this could have been different if you had started treatment when you were in 4th grade, when the teacher said there's a problem, and you decided, nah, I don't want to take medicines, or your parents said, we don't want to give you medicines, or you had the opportunity to take care of it, and then there are things that happen through a life course. So just kind of pulling back from the microscope of what are the specific symptoms and what is the data about it, just the idea of having ADHD as an adult comes with its own challenges of, one, recognizing that there's a problem, and two, thinking that if it is a problem and it fits the diagnosis, because it is a real diagnosis and it's not a manufactured thing for the drug companies, unfortunately. It's a real thing, and why would I want to be treated? Why would I want to change my life? Why would I want to be a different person almost? It's a very difficult thing for a lot of people. And we're talking with Dr. Trammell, we both go through this, where we see kids, we see teens, we see parts of the family, and the parent who's not treated, who does have ADHD, always says, well, it's not for me. You know, it's like they have the same set of symptoms as their kids, and they've had a life course of ADHD symptoms, and they say, well, I'm okay. I don't need treatment. I'm fine. But, next slide, adults have the same symptoms, or very much similar problems with executive functioning and so forth. Difficulty with concentration, trouble with sustained attention, disorganization, difficulty completing projects, difficulty listening, difficulty remembering, and poor stress tolerance, and easy frustration. So it's very difficult when you have these kinds of problems. I mean, everybody has these kinds of problems from time to time for different reasons. But if you're already set up with a chemistry or a brain structure problem that doesn't allow you to filter out things, or doesn't allow you to suppress impulses in an appropriate way, and you live constantly with this inability to deal with these things, over the course of life, you have patterns of problems that keep repeating. And the problem, with getting an adult who's at this point in their life, maybe they're in their 40s or their 50s, they've had kids, and their kids are in treatment, they're doing better, they're doing great, and they're starting to think, well, I really haven't been able to put together a career, or I haven't been able to organize a portfolio of my artwork, or I haven't been able to put together shows and put together a career in these things, and my different relationships are chaotic, and people kind of look at me as like ditzy and unreliable, and these things start to come up, and it's very easy to see why there are so many other problems that come from this. But if you don't put them all together, you sort of just see this person as troubled, or flaky, or fragile, or whatever negative term you want to add. But they kind of discount it and say, well, maybe it's a problem with character, or maybe it's a problem with will, or they don't care so much. And that's what the other person says about a person with this problem. And it's kind of painful to watch, because you can see it in their faces when they talk about what other people talk to them about, or how your best friend told you that gee, you're just kind of flaky and you missed the movie for the last time. I can't really spend time with you. So they're setting boundaries. They're thinking that they're helping the behaviors when maybe it's an ADHD problem and you just feel bad because you disappointed somebody and you sort of didn't mean to, but it just happened. So the next slide talks about, as adults, we talked about this in kids, there are associated symptoms and conditions with ADHD, including depression, anxiety, irritability, forgetfulness, social anxiety, dreading tasks, having a difficult time doing big projects, working on big projects, doing things, just regular things like cleaning the house or working on the yard or just normal adult things. It's hard to start these things. Difficulty reading, difficulty writing long pieces or filling out tax forms or reading instruction booklets or things at work when you're trying to read content. CEOs will talk about they have to read contracts, but they really don't read it. They have people read it for them, and they sort of get by, but knowing that they're sort of getting by and they can't do these things. So the next slide, depression, anxiety disorders, mood disorders, including bipolar disorder, substance abuse disorders. These are conditions that are associated, and so they a lot of times will take the priority in treatment. It's like, okay, I'm coming because I'm suicidal, or because I have self-harm, or because I have rage attacks, or I have anxiety problems and panic attacks. And so we see them coming for those more intense disorders or more disabling disorders. But when those things are better, and there's still disability, and you see this as a clinician, as somebody who's treating, you start bringing this up, and a lot of times people will be very threatened by the idea that I really don't want to see myself as having ADHD. But it kind of lends itself to the idea in the next slide that lots of things go into that resistance of I don't want to have another thing to think about that makes me feel less than. I don't want to feel ashamed about things. I don't want to feel guilty about one more thing and have to get treated by a doctor because I'm more deficient than just having a panic attack. School issues, career issues, relationship issues, marriages, driving problems, tickets, accidents. Catastrophic things happen to some people with attention lapses, and over time, people start feeling like, well, it's like, okay, I was terrible in school, I had trouble with relationships, people told me that I wasn't reliable, and I wasn't a good friend because I kept forgetting things. So you get this growing sense of inadequacy and self-esteem issue because you feel like, it just must be me. I'm just not a good person. And you kind of grow up with that, and any other insult that you start having makes it hard to want to say, okay, here's another thing I have to deal with. And it just puts it on the list. So, kind of going along the issues of, okay, if you do have this, and you start to think about it as a condition that's neurodevelopmental, it's not your fault, it's not a character issue, it's a chemical, biologic, neurologic kind of an issue that's very genetic. How does that rock the world? Well, it makes it another part of, okay, instead of having high cholesterol and heart disease or diabetes where I have to use insulin, this is an issue that takes different kinds of treatments, and it changes the way you think of what your capabilities are. So if you're in therapy with a good behavioral program, if you're in a good medication program where it's working and you're able to concentrate, and as psychiatrists we see this all the time. This is what's so kind of gratifying about treating people with ADHD, is it's technically relatively easy. It's not very complicated from a doctor's point of view if you know what you're doing. But the benefit that you see in the life-changing stories that you see is amazing and really gratifying to see people make very big changes with just a little bit of medications that are felt to be relatively mild and with little risk. So in 2 slides, let me go to the slide on spiritual struggles in adult ADHD. Talk about identity issues, talk about relationship issues. With ADHD as an adult, you learn that you have trouble with concentrating, listening, processing conflicts, dealing with relationship crises, and being able to have a consistent sense of who you are as a person, what you like and what you don't like, because the ADHD changes your focus so much, it's hard to get your identity and have a consistent sense of who you are and what you like and what people like about you, what your skills are and what your skills aren't. So it's very hard to feel like you can come into relationships and be appropriately assertive or deal with conflicts and to work them through when they're very intense, because it's easy to shift gears and get distracted when you are not treated, and it makes it very difficult for somebody to, will say, it's hard to treat you seriously because you don't want to argue, you don't want to deal with the conflicts, and you can't deal with conflicts with me. I wonder if you really care about me. I wonder if you care about a relationship. And as a person with ADHD, you believe that, well, I thought I cared, and I feel like I care, but other people tell you that you don't seem to care, and it's very kind of demoralizing just to feel like there's something wrong with the way I care. So when it comes to your relationship with God, relationship with your spiritual life, think about, okay, if it takes sustained process emotionally and focus and concentration to work through issues in a relationship, if there's differences, if there's conflicts, and to love somebody else requires that you know that person and you have a stable sense of who that person is, and you can talk things through moment by moment for lengthy periods of time. I don't know, if you're married, you know you've gone through talks where you just talk for hours or long periods of time, and as a person with ADHD who may have problems with that, it's hard to develop lengthy, depth-related issues that you just hash through. Think about that in a spiritual sense. When you're struggling with conflicts, when you're struggling with pain and trials and tribulations, if it's really hard for you to read the Bible for more than 20 minutes, or to understand and put together lessons and thought processes and apply things from your life into biblical processes, and to think, over time, God has shown me these things in these ways, and I can understand over these years that He's been trying to teach me this. If you can't put it together because your ADHD prevents you from processing that length of a process, then not that you can't grow, not that you can't be valued and loved as a person, as God's child, but it's very hard to understand what other people are doing in their spiritual life, or how they're growing, or how they're having relationships when you have a hard time doing these things for lengths of time. So when we look at how destructive ADHD is, even though, let's say, it's not necessarily something that leads to hospitalization, or you have to go on severe disability, or you can't have, you have to be on conservatorship because your mental illness takes over. ADHD doesn't do those things. You're still functioning, and you can still have a good life. But when you talk about trying to feel like you're able to do normal things in a normal way, it gets very frustrating, and if you don't understand the process of ADHD, it can be very destructive and discouraging over the course of a lifetime. So in adults, it requires things like, well, spiritual growth to sort of deal with the idea that, okay, if this ADHD is something I need to treat, can I have the humility and can I have the surrender to okay, let's try this and give up what I thought was myself, which may be very much tinged with the disability from ADHD. Like maybe with the medicines or maybe with the treatments, you can process and remember and organize and be more successful. We have a lot of cases where it's just life-changing. If they have an ADHD problem and they finally their kids got better and their kids were fine and they did great and they finally kind of stick their toe in the ice water and think, okay, give me 5 milligrams of Ritalin and see if it does anything. Am I going to be okay? And then to start trying the right doses and to get the medicine to work the right way. Can you be brave enough to be in that process and say, okay, maybe this is okay and maybe I'll be fine and God will carry me through this. And sometimes it's a very amazing kind of process and things become very different. So the last slide, resistances or reasons why not to get treatment. Because I'm fine. Well, as Christians we know we're not all fine. I've made it this far and well, without treatment, God is redemptive and God wants our growth and well-being. And I have problems, but who doesn't on the left side? Well, problems that can be resolved and healed do reveal God's glory. So there are reasons why these parts of ourselves that need to be dealt with, that would like to be seen in the light and to be healed, there are good reasons to kind of work on those things spiritually as well, besides maybe having a good result. I don't want to see a doctor or a counselor. Sometimes physicians can be very helpful, and God is always looking for our bodies and ourselves to be redeemed and to be closer to what He would like us to be, and our broken parts made whole. And medicines are just another way that that can happen. It happens in lots of different things. Cancer, it happens in diabetes, it happens in hypertension. So medicine can be for, but if there is a significant disability that you see and you're kind of wanting to run away, well, that's kind of an issue for your own surrender. But with ADHD, we've been able to do a lot of great things, and if the adults who had it go through a process where, okay, now I see that there is a problem, then it becomes kind of a spiritual exercise of, can I be surrendered enough, and is this the right thing for me? So that's where I think the spiritual is a big part of anybody who's Christ-centered, who has to deal with this stuff. It's not that you become perfect, but healing and redemption is always a good thing for us. So keep watching for that. Okay, Kent is next.